It's quite a claim, a treatment for MRSA from a humble bulb of garlic. But a businessman from Sussex says his technique for extracting and stabilising garlic's active ingredient is producing amazing results. MRSA is a bacterium which 1 in 3 people carry on the surface of the skin or nose without developing an infection. Latest figures show that nationally the government recorded more than 6,000 cases for the year 2005 to 2006. Case studies of this garlic therapy appear to show most patients were cured within 8 to 12 weeks. Sarah Smith has more.
For centuries, garlic's health-giving properties have been acknowledged, but could it really help tackle the MRSA superbug? Organic chemist and health food specialist Peter Jostling reckons it could. At this garlic farm near his home in Catsfield, he explained what it can do.
We do know that it's a very clever chemical. It actually gets into bacteria and kills them very, very quickly. Antibiotics are not quite so efficient at doing that. So we actually know technically how the stuff works, and we think that it's very unlikely to develop resistance.
The active ingredient is called Alli-C, but to get enough naturally would mean chomping dozens of garlic bulbs a day. Peter says his method gets the Alli-C out and keeps it stable for patients to use in tablet or cream form. One such patient is Peter Marking. When an operation wound infected with MRSA wouldn't heal, he tried the garlic treatment.
The wound started to heal up. It went all pink, and it not to be, it looked a nice red meat colour, as they say. And the nurses were quite surprised about this. And of course we did another test and it had been eradicated.
New procedures on cleanliness and infection control have seen hospitals making significant progress against MRSA. But should the NHS embrace Allcin for those who do still get infected?
A lot of it's based on anecdote and testimonials, and they're fine, but at the end of the day there has to be a proper trial where people are not treated and are compared with people who are treated, and the two groups are very, very similar. I'm not aware that that's been done yet.
Peter Jostling says clinical trials would cost millions he doesn't have, but unless he carries them out, the medical profession is likely to remain sceptical. Sarah Smith, BBC South Today, Catsfield.